So this is our Board of Health meeting scheduled on May 5th, 2021, 12:30 p.m. This meeting is being held by Zoom according to the Governor's Safer at Home order. And this information has been presented and posted in two places, at City Hall and at the library. The Zoom link has been posted. The meeting ID is 835-1418-4058 with a passcode of 089570. The phone number has also been posted at 1-646-876-9923. If anyone has any problems with the audio, they can call 603-821-2049. If the public does not have access to this meeting, we will have to adjourn the meeting and reschedule.
Okay. Bobby, could you do me a favor? Could you put back the screen of all the participants? I've got the paperwork, but this way I can see people who want to, thank you. That way I can see people who would like to talk. First off, do we have a quorum? I see Dr. Chuck.
Hello. Hi, everybody.
Hi, Chuck. Is Dr.
Hello.
Stephanie here?
No.
I don't see her, but I see Alex too. Hi, Alex. Thank you for attending. That being said, we do have a quorum, Chuck and myself. The first item of business is to approve the April minutes. I have to be scratched on that one because I wasn't here. I was in the hospital with my mother, so I apologize. Chuck, is there anything there, any house cleaning on that?
No, not that I could see. No.
Oh, just a motion to approve?
Motion to approve, yes, please.
I'll second it. And those in favor?
Aye.
Aye. Okay, it is passed and first order of business is done. Couldn't tell if somebody was talking or not. Next order is revisiting the mask ordinance. Bobby, would you like to start that off?
All right. So we've had some discussions and have been asked to take a look at revisiting the mask ordinance after the governor's ending of the statewide mask ordinance. And so we've had the opportunity to have some conversations internally. Dr. Wolf Rosenblum is joining us now. All right, so Dr. Wolf Rosenblum's here, Tony.
Stephanie. Stephanie, we're discussing the masks. Okay, go ahead, Bobby. Sorry to interrupt.
And we really do feel that there are some really important components to maintaining the mask ordinance for the city of Nashua. We are going to have Angela Constantino, who is our epidemiologist, present some information that we've gathered. Our incident response team has met numerous times on this with regard to the importance of maintaining the mask ordinance in Nashua. One of the things that was presented to us was by one of the Board of Aldermen, who is our liaison, Tom Lopez. The question was whether or not there would be a consideration for a date on end date to the mask ordinance. And so we want to present some information as to why we believe it's important for us to continue maintaining the mask ordinance in Nashua for the protection of the health of the residents as well as any visitors and guests to our community. So we'll have Angela present that information. Our staff is also prepared to have an add-on to some discussion points, Tony, as well.
Okay.
And then, we'll hear other comments as you deem necessary from either our board members, Board of Health members, as well as any of the public members that are with us as well. Okay, so I'd like to turn it over to Angela, who's going to present some of the data that we gathered and we were asked to gather for this presentation this morning.
Thank you, Bobby.
Thanks, Bobby. So I just have a bit of a extended situational report. So for the case update, as of today, we have 154.4 million cases worldwide. 32.5 million of those are in the US with 578,000 US deaths. In regards to community level transmission here in Nashua, We're currently exceeding 1 out of 2 indicators that push us into substantial transmission. And our indicators have been on the decline for the past 4 weeks. So we've had 244 new cases per 100,000 people, which is down about 77 standardized cases compared to last week. And then our percent positivity rate has decreased about 1 percentage point over the past week. So in the past week, there has been 332 tests conducted on average each day in Nashua, and 16 of those tests have been positive each day, which gives us a percent positivity rate of 4.9%. We are officially in the minimal category in regards to percent positivity, and our percent positivity rate of 4.9% is compared to the state's rate of 3.6%. In regards to our case activity, there are currently 7,782 cumulative cases in Nashua. Of those cases, approximately 108 are currently active and infectious. We've had 3 additional deaths recorded in Nashua over the past week for 85 total deaths and a case fatality rate of 1%. Our hospitalization rate in Nashua is at 1.9% compared to the state's rate of 1.3%. And then in regards to the state as a whole, there's been a total of 95,714 cumulative cases in New Hampshire, 1,898 of which are currently active. Last week in Nashua, we had 103 new cases, which is down about 16 cases compared to the week before. So over the past week, we've experienced a 13% decrease in new cases compared to the states as a whole, 26% decrease. Case activity in Massachusetts continues to decrease. They have 22.2 thousand active cases, and they're now seeing less than 1,000 new cases a day. Their hospitals remain stable. In regards to the rest of the country, almost every state is currently seeing a reduction in their curves, with the exception of New Mexico and Wyoming, who are experiencing slight bumps. In regards to the variants in New Hampshire, we've had an uptick of B117. So 37% of our variant cases are B117, which is up about 14 percentage points from last week. 4.1% are P1, and this past week, B1351 has been identified in New Hampshire for about 0.2% of our variant cases. In regards to B1617, the variant that is currently circulating in India, the CDC has not yet decided if they will be classifying it as a variant of concern or a variant of interest, but it does share the increased transmissibility and evade mutation like P1 and B1351. The WHO has classified it as a variant of interest, but the CDC has said that there are very few cases of B1617 in the US, but it has been identified. In regards to vaccination, as of May 3rd, 27% of the total Nashua population has been fully vaccinated, meaning 1 dose of J&J or 2 doses of Moderna Pfizer, and 43% have received at least 1 vaccine or more. Our 27% of residents fully vaccinated in Nashua can be compared to 26.2% of state residents and 19.4% of Hillsborough County residents. In regards to vaccine hesitancy, about 7% of Hillsborough County residents are strongly hesitant to get vaccinated, meaning that they would definitely not get a vaccine when it became available to them. And about 14% are hesitant, meaning that they probably not or definitely not would get a vaccine when it becomes available to them. That means that if the entire population was eligible for a vaccine, we would expect to be able to vaccinate around 86% of the total population. About 16.1% of the national population is less than 16. So if we look at the population currently eligible for vaccination and subtract those that are vaccine hesitant, we can expect to vaccinate around 70% of the population. And that's what I have for my update, Bobby.
Angela, one question. Could you say it again? I was missed it because I was writing stats down. What's the percentage of vaccinated people in Nashua?
So 27% of the total Nashua population has been fully vaccinated, okay, and 43% has received 1 vaccine or more.
Thank you. Any questions? Oh, I'm sorry, Stephanie?
Yes, Angela, thank you for that excellent report. I have a few questions. One is, and I'll ask them all at once and then defer to you. One is, of the 100+ cases that are new, do we have any general demographics on the age range? The second is relative to people that have received one but not the second vaccine. Do we have a sense of how many of those are overdue their second vaccine, as there appears to be an increasing population of persons that are declining to take the second vaccine for whatever reason?
So Kim, can you speak on the demographics of our cases right now?
I will have to look. Just give me a moment on that and I'll get back to you.
Thank you, Kim. Any other questions, Steph, that you might have?
Well, I was also waiting for Angela to say if we have any sense of people of the 43 minus 27, 43% have had one vaccine, 27% fully vaccinated, if I understood you correctly. Are those others waiting for the second vaccine, or did they miss the second vaccine?
I was going to turn that question over to Bobby to see if she had a response.
Thank you, Angela, and thank you, Stephanie, for that question. So there are a combination of both. There are people that are still waiting for their second dose, either by appointment or through clinics that are scheduled and are to be held. And then there are individuals that have decided to take a little bit of caution, and so they're waiting to get their second dose. And then there are some that it's a very fluid type of response to this. There are others that have missed a second dose due to other scenarios, either hospitalization, getting sick, going on vacation. So we did hear quite a few people had gone on vacation and were not able to get their second dose. And so they're waiting for their appointments, waiting to be rescheduled, waiting for opportunity. And then there are a percentage of those who have decided out of caution that they wanted to wait a little bit longer before they got their second dose.
Okay. Any other questions, Stephanie?
Not at this time.
Oh, Angela, can I ask a question? So in terms of other initiatives that we've had through the Public Health Department, if you consider at the end of the day that 70% of the state would be vaccinated, all else being equal, how does that compare to perhaps other initiatives that we've tried to get off the ground, in the past? Is this, it seems to me, kind of like that's a great number, though obviously we'd love to have 100, but is 70 good, bad, ugly? Or, because internally we've had some discussion around vaccine hesitancy and, what should we be doing about it? How can we improve it? Personal choice, all that stuff. But if 70% is the max, is that considered a good result? Or is that still kind of realistically just what we're going to get?
So I know in New Hampshire that we do have great vaccination rates, especially childhood immunization rates. So I think that 70% would definitely be lower than our typical childhood immunization rate, which I believe is around 98.
Oh, 97, 98. No, I know that well. That wouldn't be apples and apples though. And just maybe more like smoking initiatives, maybe not directed at you, Angela, as much, but smoking or, other awareness programs. How do we think we could compare that if we can? I'm just curious because I think we need to set realistic goals, because if we're all trying to beat our heads to get every single patient, person, citizen vaccinated, that's an unrealistic goal despite our best attempts, because we're all speaking to the choir here. So, and how to save energy and perhaps address a smaller percentage of those non-vaccinated or hesitant people to make a choice that might be better for them. I don't know. Do you know what I'm saying? Does that make sense, Bobby, or someone?
Yeah, it does make sense. And if we look at some of the hard things where, we try to get some of that behavioral change and moving people to doing things, we, for a lot of our initiatives, you have this, if you think about the stages of change where people are contemplating and they move into action, they maintain action, for the most part with things around substance use disorder. We could look at with seatbelts. It all depends on what it is, Dr. Capetta. And when people draw a hard line on where they believe their rights are being infringed upon, that's when you're going to see a big difference in uptake or use or behavior change. Things that people are more favorable for, where they really believe that the efficacy of what they're doing helps themselves and others, we tend to see, if I use the word compliance, greater compliance with that. And so we can go back to our mask mandate, right? We know that there were some very early adopters that they didn't need to have legislation. Once they learned that masks worked, they put the mask on. Then you had another shift. We had more people using masks once you had the legislation put in place. And then you just had some that just weren't going to do it. You're going to have the same thing with the vaccinations where some are just going to be the early adopters. I know I need to do this for myself. I need to do it for my family. Some people will get vaccinated. They may have had some hesitancy. And we heard a story about this even yesterday. There was someone in our office who actually said, I don't get vaccinated. I won't get vaccinated. I don't put anything in my body because I don't get sick. There's no reason for me to do it. The person did not leave this office until they were vaccinated, because then they started to think they weren't just doing it for themselves, they were doing it for others. And we've heard those kinds of stories that people that have had some vaccine hesitancy, once they're educated, once they hear from their medical providers, once they hear from trusted individuals in the community, those folks then will get vaccinated because they're doing it for more than just themselves. They're doing it to get to the place of, I want to be able to get back to normalcy. I want to be able to visit. I want to be able to do things. And so then you have that other shift of people also, moving along. And so there are efforts that we are working on and that we're continuing with our messaging. We're pushing out stories. We need our medical providers to encourage folks. There's a great picture of me giving Stephanie a vaccination, that's out there. Those are the types of things that are going to help move people along in making their decision to get vaccinated. And then there's just going to be that percentage that's just not going to do it.
Oh, thank you. Makes sense. Thank you.
Kim, are you getting closer?
It's going to take a bit for me to pull that info, so I will let you know.
Yeah, I didn't want to cut you off at the knees.
No, that's fine.
Alex, anything you want to add or any questions that you might have?
No specific questions. If we get to the point where we're proposing what would it take to relax or discontinue a mask mandate, I do have some thoughts about that.
Okay, maybe hold on to that as we evolve into it. Stephanie?
So just as a reminder, I have to leave at 1:20. I changed as many patient appointments as I could. And I know the mask mandate is a critical piece of what we need to discuss today. And that was the best I could do to switch the date. So
I appreciate that. And thank you for doing that for me. Not seeing any other questions. Alex, let's start talking about the mask mandate or the Nashua ordinance.
Yeah, so I know that people are tiring of wearing masks all the time. I don't think that it makes medical sense to pick a date, first of all. I think that should be off the table because it doesn't make any biologic sense. We could go with several levels of being strict about it. One would be to say until we have sufficient numbers of people to achieve herd immunity, we keep wearing masks. So that is not likely to happen until we can vaccinate children. So we could be looking at a very long slog with that. But as long as there are susceptible children in the population, it's going to keep going. A second would be to say that we have to have below a certain number of cases per 100,000 and then have to go maybe 2 or 3 weeks past that point before we can step back and not see an increase. So that would be, indicative of a bigger trend. I think ultimately, in my view, we should recommend what makes sense medically, and the Board of Aldermen will have to either accept it or modify it or pick something else, and that's their prerogative. I don't think we should necessarily, in this position of the Board of Health, I don't think we should be compromising, the safety of the public. If it may not make economic sense to do what we're doing, but I think that's not necessarily our charge. But I think dates don't make sense. Picking some target indicators, that's what we should really be focusing on. I am not sure what those target indicators should be, apart from herd immunity, which is not readily achievable in the near future.
Okay. Hot topic, but Alex brought it up. Chuck, would you like to comment on pediatric immunization? I know Pfizer is on the doorstep with CDC to get it approved, but
Yeah, and I think if it happens in the next 2 weeks, it'd be great. I had 2 questions this morning about it, and they asked me would I recommend it, and I'd say 100%. So I'd love to see it go down to 6 months. I don't see that happening initially, but make it like the flu shot. But if we get to 12 and above for now, that's a start, and then we carve away that and get some more data based on science, et cetera, then we're off and running.
okay, thank you. Kim, I know you're back, so go ahead.
Okay, so Flavia and I were able to pull this between 0 and 19 years of age for our current active cases. 0 to 19, 25 cases, 20 to 30, 20 cases, 30 to 50, 20 cases, 40 to 50, 13 cases, 50 to 60, 20 cases, and those 60 and older, 17 cases.
Thank you, Kim. Stephanie, does that answer your questions?
It does. Thank you very much.
You're welcome.
Any comment on that, Steph?
No, I am, in the absence of knowing the vaccine status of those individuals, I really can't drill down any further on my questions, although I'm not surprised to see that a significant percentage of those are in the populations that were only recently eligible to be vaccinated, the younger people. That's what's really seen in countries that are pursuing vaccination policies.
Okay, very good. Bobby, do you want to weigh in on anything else?
Yeah, I would just like to weigh in on the numbers that the nurses just presented on the number of cases, where you can see that the majority of the cases that we're following right now are in the younger population group. As Stephanie just mentioned, because that's the group that's just opening up to vaccine, or we've just started, but you can see that that's a decrease in the older population because there's been more vaccination in that population group. There's also been a decrease in the number of hospitalizations and deaths in that population group, which is really important. So we know that a combination of both the vaccination and the mask usage is going to continue to allow for us to get to the point where we want to see is a decrease in cases, decrease in deaths, and decrease in hospitalizations. Our hospitals did a report out for us at our joint team meeting this week, and they are still seeing cases coming in to the hospital. They're still using, having a number of people under investigation. They still have folks in their ICUs that they're observing. They're still seeing positive patients, a decrease in their hospital personnel, again, because of vaccination. And so for the cases that we have been seeing, some of those have been in individuals that have not been vaccinated as of yet. So we know vaccine is going to be key. And until we get to the point where we have the majority of the population vaccinated, it means that there's virus that's still in the community. As Angela mentioned, our percent positivity rate is going down, but our cases per 100,000, it's still up over 100, so it's still pretty high. That's another indicator and another reason for us to continue with the mask usage. We still have been having reports of deaths. In fact, there were 4 in Nashua, I believe it was last week? So we know that those things are still occurring, which means we're still in the pandemic, although things are looking better. If we relax on some of these mitigative measures, we will see an increase, as we have seen trending throughout this year, over the past year, when people come together, when we release our standards with the mask use and distancing, we see our cases bump up. We've seen that occur. And so it's really important for us to, just as Alex mentioned, Dr. Capetta mentioned, and Stephanie mentioned, it's really important that we continue to do what's best for the community, even though it may not seem favorable. All these things that we have been doing have been able to protect and preserve the health of the public with these measures, including the continuation of the masks. We also know that some of our businesses are also in favor of this as well. Some of our staff have had opportunity to talk with folks in the community, and they can share some of the things that have been shared with them. Tony, if you'd like to hear some of their comments as well. The board would like to.
Nope. What I would do is I'd like to respect Stephanie's time. because her vote is important. Also like to recognize Alderman Lopez, who's on the call now. And I think I saw Steve Bolton. Did you? Yeah, Steve, go ahead.
Oh, I'm just letting you know I was here.
Okay.
I don't necessarily have much to add.
I'll mark you down present.
I do.
Okay, Tom, please.
I just want to continue to express my concern about not making any changes to the ordinance. I think the perception that we shouldn't choose a gate, the Board of Health is choosing a gate. You're basically ceding the authority, because this is a scenario where both the Board of Aldermen and the Board of Health can remove the ordinance. And I think the Board of Aldermen are looking for recommendations from the Board of Health. So if you don't change anything, then all of the pressure remains on the aldermen. And there was the memo that went forward when the governor started opening things up that reassured people that a decision was pending. And just for the record, be it in the minutes, I have sent numerous ideas and recommendations about different benchmarks that could be used. And we do refer to them in meetings, such as the growth rate, the percent positive, all those things. So you use those as guidelines, but you're not implementing any of those in an ordinance or in any kind of guidance for legislators. So if you're not going to change it, sooner or later the conversation is going to go back to the aldermen. And I would bet it's not going to be any later than July. Like, you basically have another meeting to consider this before it really does go out of your hands, because even at the national level, the commitment to this is changing. So I think it's worth considering that fatigue happens on more than one side, not just the people who are looking for return to unmasked life or looking for the end of the COVID. But I think as healthcare providers, you're experiencing the fatigue as well, which means you don't want to engage in these decisions or arguments without having all the facts. And I don't think that's going to help us. I think we're going to get into a situation where people with no health backgrounds start driving the discussion.
Thank you, Bobby. Oh, I'm sorry. Bobby first.
Bobby, yeah.
Sorry.
So the mask mandate that the city has in place allows for the protections to go across the board. So Alderman Lopez, the state has put out when folks are vaccinated, fully vaccinated, they can come together without their masks, right? And so you have certain things that folks can use, and that's been pushed out already. Even in the governor's best practices, what's listed there is wearing of masks, right? And so each city, town can make their own decisions about that. There were plenty of individuals, businesses that all gave comment to the ending of the statewide mask mandate was too premature, right? Because we still are in this pandemic stage. We have the variances that are out there. We still don't have as many people as we would like to get vaccinated that allows for us to just say, we're just going to do away with the mask mandate. And as I mentioned before, there are those who, because the mandate is in place, they will wear their mask. Once that's gone, it's just all out. And we are at a place where we've seen our numbers go down. We want to be able to maintain that. As people continue to be vaccinated and they're fully vaccinated, folks can, in their spaces, be without their masks. I just, as a public health official, to just carte blanchely just totally get rid of the mask mandate, I think it's just setting us up for a huge spike in cases at this point in time right now. I just think it's just.
Well, I fully agree. And that's why I'm concerned that that's essentially what the Board of Health is doing, is passing it out of the Board of Health's hands into political hands. But just for a clarification for a comment you said earlier, Attorney Bolton, Director Bagley mentioned the CDC's masking mandate and guidelines for best practices. Are any of those legally binding on any people or businesses?
I don't think the CDC's recommendations are a mandate at all. They're just what they are. They're recommendations. So there's no legal impact to those recommendations. I think what we have in Nashua is the ordinance, and there is no other state or federal requirement on the subject.
Right. So that's where my concern is the faith that you hear from businesses making comments that we've dropped the ordinance, or that we've dropped the statewide guidance too soon, a month ago. People have adapted to that, they've acclimated, and the neighboring municipalities have chosen not to do a masking mandate at all. So the argument is going to start to say, well, if you're safe in Hudson, why is crossing the national line not safe? The authority for the masking isn't.
I don't believe they are safe in Hudson.
No, but my concern is about the perception that if it's safe over there, why isn't it safe over here? We're doing a better health practice. We're, in my opinion, making the right decision. I don't want that decision to be taken out of the hands of the Board of Health because it doesn't change it or modify it in any way. I don't think people are keeping their masks on by and large because they are doing the right thing or conscious or that type of thing. I've already seen a number of places where people are starting to be unsure as to whether they need to mask or not, where people aren't stepping forward and saying, okay, you need to wear your mask in this circumstance. I think we're seeing that fatigue that we talk about, but aren't really acknowledging. And if we don't come up with a mechanism for people to at least look at gradating it out or basing that decision on health factors, it's going to be replaced by political rhetoric or economic pressures or just lack of faith in this. And it may additionally color any future attempts if we need to reimpose guidelines. If we have an outbreak in the fall and the Board of Health wasn't part of managing the mandate, and it does end up getting to that point where politicians get involved, any attempt to try to return to a mandate, the first thing people are going to say is, once you put this in, the Board of Health is never going to let you take it down.
Chuck, you had your hand up.
Well, I guess I'm Alderman Lopez. I thank you for all your efforts on our behalf. You're such a pro Board of Health advocate for us. So I guess I'm confused on what you're saying. You're saying, because if I can quote what you said, it's going to be taken out of the Board of Health hands because we're not standing up for something or not advocating for something. I don't know how that's possible when I just heard my colleague, Dr. Grenick, say, we can't set dates. We're not waffling here. We're not, vaccinations aren't coming anytime soon that will bring the herd immunity down to where we need it to be. So, yes, we're going to try to develop target, criteria, but that doesn't mean we're saying nothing. I guess I'm confused on how you're presenting it to us that we want to get to some place that the public see us doing something, but then you're saying all of a sudden it'll be out of our hands. It becomes a political time bomb.
And so that's one of the reasons I think it's good to have Attorney Bolton here. So just to alleviate my concerns, Attorney Bolton, it's my understanding that either the Board of Health or the Board of Aldermen could amend this or end this ordinance. Is that correct?
Well, and to make it clear, I was more or less of that opinion at one time. Since we had the initial judicial determination when the mask ordinance was challenged, the court relied on the authority of the Board of Aldermen in upholding our ordinance. So given that judicial determination, my opinion now is that it's really the Board of Aldermen. Now, I think they will be responsible and rely upon the advice given by the Board of Health. But it's really the Board of Aldermen that can determine if and when and under what circumstances the ordinance ought to be eliminated, altered, amended, extended, any of those situations. It would not be a bad thing at all for the Board of Health to set forth a list of factors and say, for example, it's the recommendation of the Board of Health that mask requirement should continue until such and such percentage of Nashvans have been vaccinated. We have had no COVID-related deaths for X number of days. The percent positive for testing has dropped below such and such percentage and has stayed there, stayed below that figure for X number of days. So criteria which, until we get there, you shouldn't even consider lowering it until a number of these criteria have been met. I think that might be a step that could be taken and might be viewed positively by Alderman Lopez and his colleagues on the Board of Aldermen. I have to agree with what's been said earlier that setting a date strikes me as not very scientific or medical, and if the determination is based on arbitrary dates because we want to have good rooms and meals tax revenues for the summer, I think we've moved out of the medical scientific considerations into things that are not related to that goal.
That's what my concern is, because we've already seen the governor do it, and we already know that the president has done it. So we're caught in the middle, and the people who are ultimately going to enact this decision are going to be looking around and seeing these other factors at play, and they're not medical. They're not supported by data or anything like that. Just picking Independence Day, like I don't think the anniversary of our throwing tea into the harbor is particularly germane to this circumstance. That's a political decision. And it was said earlier that I was trying to end the ordinance. I've explicitly been trying to make sure that we continue the ordinance as long as it is needed from a healthcare perspective. And that's what I've been advocating for since January, because it was presented by this board back when we were having the conversation about the curfew, that there would be work done in figuring out the criteria in order to phase it out. Now, phasing, in my opinion, doesn't necessarily mean unidirectional. As we surrender one goal, achieve one goal, we surrender control over it. That, I think, is the concern that I'm hearing from members of the healthcare community, and I understand that. But I also think that if we don't come up with any goals, then other priorities are going to start taking precedence. I'm only one of 14 aldermen. Did I get that number right? Turning vote, and I just like miscount that. So any of the other ones could come up with a different plan based on other criteria, whether it's the downtown improvement committee pressuring them or whatever.
Alderman Lopez, I'm gonna cut you a little bit short, not personally.
No, I know.
Stephanie has to leave at 11:20, and if we're gonna take a vote, I'd like Stephanie to be here. So continue your thought process, but Stephanie's had her hands up. Stephanie, you're up.
In an ideal world, I would have also liked to have heard, I think we have some public members, but I have a few key points I'd like to make, and I will do my best to stay on until the vote. But I do have to leave in 10 minutes. It's a hard stop for me.
Go for it.
One, I hear Alderman Lopez very loud and clear, because if we talk about the science today and the science when we made the mask mandate, it looks very different. And if we say that we pick a path of minimizing risk as much as we can, independent of whatever downstream that has, be it political, financial, etc., then I do agree with Alderman Lopez that we run the risk of limiting our credibility going forward, because our mission is to recommend pathways that balance risk and choice. We do that when it comes to food. We do it when it comes to all sorts of things. So what I have to say is with that in mind. The second thing is, this is not a linear journey. By that I mean to say, we don't know where we end up. We thought we would know by now, but we don't. So to say we will use a metric about number of cases, number of deaths, when our testing rates don't allow us to detect asymptomatic infection, which we know can result in long haul COVID for some people, that can result in super spreader events. When we don't know what the variants will do, when we hear that the variant from India is now in New Hampshire and we don't know what that means, but something's going on in India that is a complete tragedy, then to say that we will have a piece of data, never mind the date, but that we will have data tomorrow or the next day or a week from now, I think is specious. I don't think we're going to have that information anymore. I think that we're going to have the type of herd immunity rates, even for adults, let alone children. What that means to me is that we need to make the best decision we have today and to be very mindful and to communicate clearly that whatever decision we make today is only based on what we know today, that the decision is meant to not eliminate risk, but to advise and minimize risk. With that in mind, and knowing what we know, I think the current CDC recommendations that masks are not needed outdoors for activities where people aren't on top of each other should be strongly considered as the next step of our mask mandate. There is no question in my mind that indoors without masks is a huge mistake right now, based on the science, based on our rates, based on what we don't know about transmission, based on the testing we're not doing. However, to state that mask mandates in an outdoor environment are still required in all cases, I think runs the risk of us being perceived as overly protective. And so I wonder, Alderman Lopez, what you would think about us reaffirming the need for mask mandates indoors in public environments where you don't know who's vaccinated, we don't know how long even the immunity is going to last for the vaccinated persons, but eliminating the outdoor mask mandate for activities that don't involve crowded in circumstances like, to Dr. Walensky's example this morning, 20 10-year-olds pouncing on a soccer ball and breathing heavily on each other.
Well, to be frank, and Attorney Bolton can correct me if I'm wrong, I don't think our mask mandate does apply to outdoor environments. I believe it is mostly indoors where social distancing is not possible. What I was recommending is that the board consider including language that allows for reintroduction of it if there's an outbreak in a specific population. So for example, monitoring children who are too young to be vaccinated. If we start to see a surge in that population, having the Board of Health retain language in the ordinance that allows it to, during an emergency meeting or at a monthly meeting, reinstate it for that group and then announce, okay, everybody under 12, there are masking mandates. The mask mandate is in effect if you're indoors, and then having varying degrees. So the recommendations that I had emailed to the Board of Health members and to Director Bagley were more in line with giving the Board of Health control over the mask mandate moving forward so that it doesn't turn into a political on-off switch. But Attorney Bolton, can you give a quick summary of what the mask mandate does cover, just so we're all familiar, because there's a lot of different things going on. I think that the youth sports are the ones who are behind children playing on soccer fields wearing masks. And I'm not sure that that's consistent.
That's not in our mask ordinance. Our ordinance only requires masks outdoors at places of business. So lining up to be seated at an outdoor table at a restaurant, yeah, you're required because that's a place of business. A customer in at a garden center or something, which is sort of outdoors from the main body of the store, because it's a place of business. I think the rationale behind this is people are going to be buying things and standing close together at the checkout or interacting with one another in the aisles or what have you. So in a place of business, even if it's outdoors, masks are required. But you're walking down the street, there's no requirement for a mask.
This is where it gets problematic, I think, because if you're talking about Holman Stadium, everyone should probably be wearing a mask when they're there from a health perspective because of the crowd of people. But it's a business, so we can do that. But alternatively,
talking about a high school sporting event,
exactly,
or something that maybe not. We have not covered that.
Right. So because the science was different back then, but they are all still sitting in bleachers, most likely sharing air because of the circumstances. If you have a group of people that are gathered for, say, a road race, they're standing in a crowd, not social distancing, and there's no mandate right now saying they need to do that. So our masking mandate was the first round of interventions before the governor's was implemented and before other agencies jumped in. So kudos to us for that, but it also really needs to be reevaluated. And that's where I think it should be amended as not just turning it off. I think we need to replace or amend the current guidance so that it's not quite as straightforward as just saying, do we have it or do we not?
Okay, Alderman Lopez, you're the unlucky guy. I'm going to have to cut you off. Again, we only have 1 minute for Stephanie. I did recognize Chuck raised his hand. Stephanie, if you can hold on, I think it'll be important. Chuck, what do you have?
Well, I just, again, because we're going to lose our colleague here in a minute, and Alderman Lopez and Steve has brought up some great points. Can I maybe propose a motion that we just, maybe as a Board of Health, just, offline here now, given all these conflicting things, just kind of agree to meet to kind of review, like Mr. Bolton just said, what they are and what they aren't, and then come back to you in a reasonable time frame in the next week, just to say this is what we're thinking about. I think I don't want to lose it, but I don't want Steph to leave and not hear the rest of this discussion. So my motion would be to review the modifications or things we can look at and go from there.
I'm really sorry. We just can't shortcut this. It's just too important. And this is a critical discussion. I think it needs to happen in a public forum. And I know I'm not prepared to vote on anything at this time based on the discussions that we've had and the confusion that's here. I also don't think we need enough or have enough of a shortened feedback loop to be able to, turn things on and off. If there's an outbreak, a public health department could do that. We could cede authority to the public health department to do that if we had the right formula. But the board is just not in a position to be able to be that nimble. Our meetings right now.
Stephanie, we have a motion on the floor. I'm looking for the second of the motion. I'm going to remind you that the motion from Dr. Capetta is for the Board of Health to meet. And I think what he's talking about is come up with modifications that are scientifically within the realm of things, then bring it back to the public forum for a total discussion things that we all agree on. Right now we're playing ping pong. Ball's going back and forth. We're really not getting any traction. Steve, is it a point of order?
Yeah.
Okay.
You can't meet other than in a public meeting.
It will be a public meeting. I understand.
Okay.
It'll be a meeting, but this gives the board a chance to look at the new data, come up with some guidelines that we think are defensible, and then take that, even though it's a public meeting, bring it to the next Board of Health meeting, and from there, open up the discussion and go from there. Because all I'm seeing is a lot of spinning. I'm seeing a lot of people repeating the same things. And as chair, I want to keep you on point. And I don't see this as going on point. Plus, Stephanie has to leave. I don't want that vote to be just two people. I want all three of us to be there to have input and make sure it's there. So
Can I make a quick recommendation?
certainly quick.
I think what you could do is amend the vote that was made to have board members work with Director Bagley, and then Director Bagley present a draft of changes that could be brought for a future meeting.
That's usually what we would do.
So there's the board meeting secretly. Individuals are meeting with the direct, so that gets around, that addresses the concerns that would be there. And then the motion will really be just to take that action of coming up with a draft and having Director Bagley put it all together.
Alderman Lopez, the way any meeting is, my executive director is always there. Okay, unless something were to happen to her and she's in the hospital or something. But the director.
I'm really sorry. I have to go. I told you. I take my responsibility very seriously, but I must leave 3 minutes ago.
Go ahead.
We need another meeting.
I agree. All those in favor of another meeting? Aye. Okay, we're going to table this, a special public meeting to come up with some guidelines that we can then further discuss and vote on that everybody feels comfortable with. Okay? It was unanimous. Thank you. Bye, Steph, wherever you may be. Anyway, having said that, is it okay if we move on to the Board of Health meeting?
Yes, but I would like to just make a comment now because I think it's more appropriate now than any other point in the meeting.
Okay.
I have asked Director Bagley and the mayor about the possibility of expanding the size of the board membership to 5. Mm-hmm. And I want to clarify, it's not because I'm trying to like Supreme Court stack or anything. It's because you're all very busy professionals and this does happen. And this is an example where a conversation could have continued if you'd had 5 people instead of 3, because one of you has to go to work and then you're struggling.
Well, expanding the board is totally, it's up to you guys to do that. But I will tell you, being chair of many boards, this was spinning down the tubes. You weren't making any headway. There was actually a debate going internally that wasn't moving in the right direction. And we do have a hard time. Everybody has to go somewhere or do something. It's now well past, 1:30? And the board meeting usually lasts to 2 o'clock, and we have a bunch of stuff. And if we had other people here, they'd probably be dropping out because they've got things to do, because we scheduled these meetings 12:30 to 2. Mm-hmm. So that's really the reason why. And Stephanie moved this meeting to today. She moved all her patients that she could because of me. I called in a favor. Chuck did the same thing. All right. So you guys can do what you want to do with the number of people on the board. I just want to be clear that there was other things going on here.
Right. And I only suggested that it be looked into. I didn't want to make a move on it, but because I'm not literally a board member, I wanted to at some point comment on that so that, number one, I was upfront with the actual board that this is something I had started, at least the conversation, and that what my motivations was to take the pressure off of a small group of people having to be obliged to meet and make decisions when they, especially in a circumstance where they themselves may be involved in addressing the crisis to be discussed.
I understand. I've been on bigger boards and I hear all the excuses too why we never have a full complement of people at the big meetings as well. So it can go both ways. Steve, you want to add anything to that, or?
Other than to ask to be excused myself since I have another meeting started.
You are so excused. Let's move on to our regular meeting because we've got a lot of stuff to do. Thank you, Tom. I appreciate your input and your comments as well. Let's do the department summaries, and why don't we start right out with community health? That's assuming anybody's left.
I'm here.
I hear you, but I don't see you. But go ahead.
It's Kim.
Oh, hi, Kim.
Hi there. Here I am. Here I am. Yes. So, community health has been continuing with our efforts, our outreach efforts in all our other areas, including our immunization-led STD, HIV, hepatitis C, SANA. All of our other efforts are still continuing. We are also part of the vaccination strategy for COVID-19, and we have been working trying to vaccinate as many people as possible within the community and the greater Nashua area. And we don't have anything huge to report, but just that we have been continuing with these efforts. Flavia is going to speak to specifically to the COVID-19 piece of this with any outbreaks and clusters. So I'll hand it over to her.
Thank you.
You're welcome.
Hello.
Hi, Flavia.
So this month, hi. So this month we've had a total of, oh, my apologies, I don't have my right notebook in front of me. So if you bear with me for just 1 minute, wrong window. One more second. All right, so this month we investigated a total of 7 outbreaks, and that's an increase over last month where we had 4. Congregate settings investigated 56. That was also an increase over the last month. But our overall cases went down to 481 this month, where we're just over 600 total cases last month. So we've seen a fluctuation of total cases slowly going down over the past 3 weeks. But we are seeing more outbreaks associated with these cases out in the community and in different settings, congregate settings that are being affected, which are being under watch and monitored. And yeah, I think that's all I've got. Thank you.
Thank you, Flavia. Okay. That being done, sorry for disorganization. How about our epidemiology? Angela, anything you want to add to what you already said?
Yeah, so just for non-COVID stuff that we have going on, our work on the Community Health Improvement Plan continues. So we're working specifically with insight formation software. So we're getting training on that software, and we're developing our strategic goals and objectives, and we'll have it hosted on that software on our data dashboard. So we're really excited about that. And then we also have our 5 priority areas in the surveys that are going with them. So we're having 5 provider surveys or community-based organization surveys, and then 1 family survey for maternal child health. And that family survey is translated into Spanish, Portuguese, and Swahili. So we're going to be pushing it out to different groups. And then the other priority surveys will just be to community-based providers. So yeah, you might see some of those coming up, and we're just looking to share them in the community. And that's all I have.
Thank you very much. Any questions for either Flavia or Angela? Seeing none. Nicole.
Hey everyone. So I just have a few things. If you have questions that I don't report out there on my report, just feel free to ask, but I'll try to just hover over the big stuff because April was a busy month. So in regards to COVID, I continue to oversee all the public information, so updating social media, the website, and our weekly newsletter. And I can continue to facilitate our city's Joint Information Center meetings, which happen every other week. And then I also attended 3 of our mass vaccination clinics to oversee all communications and marketing. So like I said, April was a little busy. So in regards to the pause of the Johnson & Johnson vaccine, we were able to provide real-time information to the public. So we shared any updates on our social media, gave updated information to our hotline staff, and we actually had to send out information to all registrants of a clinic that we were hosting the next day as well. We also provided the health alerts, press releases, and a full FAQ to our regional partners and city staff. And then our community health workers continue to work with our community to provide accurate messaging about the vaccines to work on reducing vaccine hesitancy. And our communications team provides them with updated messaging and materials in a variety of languages so they're able to share. And we also provide this education on our weekly radio show, our TV show, through our hotline, and through our outreach that all the staff is involved in. And then we also disseminated information about the expiration of the state's mask mandate and the continuation of the city's mask mandate, which we just talked about. So when that happened, a press release and signage was sent out to the media, as well as local businesses and our food service establishments. And then our communications team just continues to focus our messaging around encouraging our communities to stay vigilant until enough people in Greater Nashua and the state are fully vaccinated. So we have been pushing information about the spread of the variants in our recent newsletter and have been updating that on our website as well. And then I did want to mention that with the assistance from our community health workers, we also distributed COVID vaccine information and resources to all of our healthcare providers in the region. So we sent out packets that included a letter from the director. We had flyers in a variety of languages. We included COVID brochures and also a laminated card with contact information from all of our staff who are able to register individuals for our vaccine equity clinics. And then in addition to COVID work, in April, I was able to complete mailing toolkits with lead testing information to all of our regional healthcare providers. And that was the last deliverable of our Lead Greater Nashua initiative that ends next month. Our lead nurse is actually going to be following up with the providers via phone for an evaluation to determine any barriers for lead testing at the provider level. And then I also want to mention that we are currently running a regional marketing campaign for Mental Health Awareness Month. And this campaign is to promote the 5 signs of emotional suffering and healthy habits for emotional well-being. We're doing a billboard, bus ads, social media posts, newsletter articles, and a few print ads in the local newspapers. And then lastly, I just wanted to mention we're also running a regional campaign to promote our STD clinics for STD awareness and Hepatitis Awareness Month. So for this campaign, we're doing some newspaper ads, a Facebook ad, and an online regional campaign that promotes our website on over 100 apps. And that's my update.
Thank you very much. Very busy month indeed. Any questions regarding Nicole's information? Seeing none, we're trotting along. The emergency preparedness, are you going to cover that, Bobby?
Just with the update with emergency preparedness, we have our coordinator resigned during the month of April. And for right now, I will be the interim contact for the state and working. Patty Crooker, who is also paid under that grant, has taken on additional responsibilities so that we can make sure that we can maintain the response efforts that we need to. And we also have, as a part of emergency preparedness, other members of that team would include the epidemiologist, our health promotion specialist, our admin, and then our staff has been doing yeoman's work with the response efforts that we've had in place right now. And so we believe that we'll be able to maintain our response efforts at the vaccination clinics, at our testing clinics. And then as far as, again, the role administratively or coordination-wise, Patty and I will be fulfilling that role with the support of the staff that we have here. And we have some great staff to help with that. And that's basically the update from there. The position has been posted. I do believe that I have received 2 applications for that position, and I'm hoping to review those today. I needed some help from HR because I couldn't get into the system that we use for the applications to come through. So hopefully I'll be able to get into those today, but we have received 2 applications. And we do wish Michael well. He was a great asset to our team. He's taken a position in Manchester as the safety officer for their transit department in Manchester. So he's just about 15 miles away if we need to tap him. And that's the report from emergency preparedness. And we'll have a more formal report written up for next board meeting.
Public health strategist report.
So I'm going to really just piggyback on what Angela said. I work a lot with the CHIP. I'm co-chairing that with Bob, and we are moving that the community health improvement plan right along. We have a few different issue areas that rose to the top, probably mostly because of the COVID-19 pandemic. So communicable diseases rose to the top this year. along with maternal and child health, which was on there previously. Emergency management and behavioral health are always on there, and chronic disease. So I'm also having the opportunity to co-chair the chronic disease work group, and really excited that we have good representation from all of the providers in the community working on those issues around chronic disease. And the other piece I'm doing within the division internally is our strategic planning. We were due for our new strategic plan in 2020. We clearly were a little busy in 2020, so we're picking it up for 2021. It will be a 4-year strategic plan. And we've been able to survey our staff internally and also our external partners, which I believe some of you were able to take that survey, and that's very helpful to set the direction for the next 4 years. So we are working on that pretty diligently. And other than that, I'll try to back up Nicole when I can because she's very busy. That's it.
Very good. Teamwork. Any questions for Jane? Okay, seeing none, let's move to environmental health. Heidi.
Good afternoon, all. How are you all? Hope you're doing well. I'm going to speak about a couple of things that we're doing currently, and they really do reflect to the way that the landscape has changed due to COVID for our department. We are taking a close look at what the impact of the governor's Safer at Home guidelines sunsetting and how that's going to affect special events, how it's going to affect outdoor dining, how it's going to affect some other things, because it will be just pretty much recommendations, and there isn't a should in the document. There are all kinds, I mean, there is not a shall, there are shoulds. So they are much gentler recommendations and really not enforceable. The only thing that we can enforce here locally from any of that would be the mask mandate, and that we provide information and we do site visits, but it's up to the police to actually enforce that. So ever-changing landscape. We have been immersed in COVID activities. We're having to, as a department, step back a little bit from that because we have started resuming our food service inspections, and noticed a great deal of variability in our food service establishments. And certainly some have gone out of business. They're having a very hard time keeping staff, educating staff, and we've seen some of our business partners do very well despite our not having completed strict routine inspections. And we've seen, say for instance, someone who has recently purchased a food service establishment and it's not their background, they're new to it, they're really struggling. So we're doing lots of site visits. And our approach is that these are unscored inspections. They're simply pass or fail, and we are not charging a reinspection fee. And we're going back as many times as necessary with education in mind to try and gently work people to a place of compliance to protect the public. And so that's the lion's share of what we've been working on.
That's very nice, Heidi. I think a great way to, help people out in our community. And I applaud whoever thought of that. Congratulations on that. Any questions for Heidi?
Oh, can I ask something?
Yes, sir.
So Heidi, do you think, just referencing the mask thing, what do you think the percentages are with businesses in terms of pushback, or have you been getting a lot of feedback on this? And
yeah, I think we all have in the field, and it's a decided 50-50 split. The gentleman I spoke to today was very appreciative that we had a mask mandate because it kept his business safe. I have heard from other business owners who have said that it has decimated their business because their clientele are not the type of people to typically want to wear masks anyway. So it's been very hard, and his business has suffered significantly. So those are the last two people I've spoken to, but it is pretty much 50-50.
Okay.
Thank you.
Thank you.
Thank you very much, Heidi and Ren. Any other questions? Seeing none, I think we're going to wrap things up. Well, I'm sorry, take that back. Bob Mack for welfare, please.
Thank you. Bob Mack, Welfare Officer for the City of Nashua. Just reporting out on the Welfare Department for the month of April. Historically, our expenditures are down for the month of April, primarily due to the fact that a lot of folks that may apply for assistance have received income tax refunds or earned income tax credits, so they tend to have more sufficient resources to cover some of their basic costs. This year, of course, we also have referred many people to the COVID Relief Fund programs, primarily offered through Southern New Hampshire Services, the CAP agencies across the state, ours being Southern New Hampshire Services, where if people have a COVID-related financial hardship, they can apply for rental or utility assistance directly through the CAP agency. So a lot of the calls that we've been getting and inquiries have been directed there. We do continue to work closely with our partners for folks that may not have COVID-related financial hardships, and we evaluate those cases, assist as we can, and then also refer out to our partner agencies in the community. So that being said, to date, we've expended around $320,000 of the general assistance budget, which is approximately 60% of our budget for the fiscal year, with a couple months remaining. I don't know if there are any questions.
Any questions for Bob? Seeing none, thank you very much, Roberta. We're saving the best for last. Bobby, Director's Report. You thought I forgot about you.
No. Well, I'll just do a quick overview because it is getting close to the end time. Just for a review of the month of April, we celebrated Public Health Week, where we were able to acknowledge all of the work that our staff has done over this pandemic year. Again, with the many sacrifices that have been made with time, effort, energy, the collaboration that has been done across the division, across the departments. We just had to make sure that we made that acknowledgement, and across the nation, that's celebrated for public health workers, which also includes our partners as well, so acknowledging the support, but really for frontline staff of our public health workers, to give our team the kudos for all the great work that has been done and that continues to be done. Also, during the month of April, our budgets came through for city budget as well as for our state budget for our public health network services grants. And so all of the budgets have been approved and have been moved forward, and we have the funding that we need to be successful in going forward for the next fiscal year. We will have additional funding continue that will carry on for another year for our public health response, which is our enhanced detection funding, and that's a pretty significant amount of money that will support continued disease investigation, contact tracing, and some monitoring, as well as some other components of disease investigation that we do with regards to COVID. Operationally, we're down one staff person, but we're still maintaining a sufficient staff here with all of our division staff, the community health workers that were brought on and covered by 2 additional grant funding that we have, and the CDC staff is with us until June 30th. And so there's a couple of nurses that are here that will be around until June 30th. We continue to work, as you've heard from the reports from the other staff, collaboratively and collectively with our partners with these ongoing measures. And you've also heard that the staff continues to do their day-to-day deliverables as well, which again, just shows the workforce that we have here, which is tremendous efforts that have been put forth. Also during the month of April, as far as, as the director, I've been appointed to 2 additional commissions out of the governor's office, the New Hampshire Opioid Abatement Commission and the New Hampshire Overdose Fatality Council, both of which look at what's happening with opioid and SUDs. We did not expect that COVID would cure substance use disorder or mental health issues. And in fact, we've seen an increase in rise. And these two commissions are looking at funding that's going to come in to the state as a result of, one of them in particular, as a result of the lawsuit against the pharmaceutical companies, which our city and the region tend to gain some financial support as a result of that. And pretty much that's it over a wide overview. We just continue doing the work that we do, and it's really important. And I'm glad we did have the conversation early on about the mask mandate, about the importance. You've heard where, we all stand with that. You've heard, even though our numbers are going down, our staff is still continuing to investigate cases. It was really important that Flavia mentioned those cluster outbreaks and how those, what those numbers look like, and those, increases there. And that results again from exposure to, the virus that's there, as well as to the need for increased vaccination. And you've heard about what are all of our efforts around increasing messaging to decrease hesitancy and to get more people vaccinated. We really believe that by doing a combination of these two things, we will get to the point of we won't have to wear and worry about a mask ordinance if we can get a little bit further in the efforts that we're presenting right now. We did send out, and I believe, and if I didn't, I apologize, but our team has been reviewing the best practices that came out from the governor's office. We're pushing that information out as well. All the mitigative measures that have been in place are listed in the best practices, just without the support, or the rigor from the support from the governor's office or from the state, with there being that ordinance in place. So the expectation, is that our communities, will do the right things, which many have. And again, through us having the mandate in place, it allows for many more to do the right thing as well. So that's our update for the month of April, and where we stand right now. And I don't know, Tony, if there are any questions. I do believe that there is, I think there's a public member on, that's in attendance at the meeting, Tony. Okay. So I don't recognize Christopher Weir.
Okay, first off, any questions on Bobby and her report? Alderman Lopez?
Yes, I know the city has well, not city. I know that you were instrumental in organizing the SUD continuum, and then also the mayor did have a committee on mental health or mental wellness, because even before COVID, we were seeing a surge locally of people, with acute mental health issues, depression, suicide rates, that kind of stuff. Are those groups still meeting?
So those groups have, the Mayor's Opioid Task Force has continued throughout the pandemic. The Suicide Task Force, which we're probably going to change the title of that, that group, met the last time in December and has not convened since. Lisa will be working on and has set a date for the next scheduled meeting for that particular group, because again of what we've seen come back with regards to substance use, mental health and suicides, in our region throughout the pandemic period. And so that group will be reconvened. At this time, I don't know what the date is, but Lisa and I have talked about scheduling that meeting. And so that will be kicking off with the same group of individuals. And we've got some other folks that have been added to that group as well.
Okay, just in terms of messaging, it wouldn't be a bad idea to promote crisis support and intervention services. This is the month of mental health awareness, and there was recently a suicide that impacted a number of Nashvans. So I think just getting that information out there wherever we can is helpful, so people don't feel like they're alone or, struggling with grief while everybody else is celebrating.
Right.
Nobody's celebrating.
I just wanted to mention, we actually just worked on a press release that's going to be going out Friday that has that exact information in it.
Okay, awesome.
And we also have a campaign, Nicole. We just put our billboard up for mental health. It's not Know the Signs, but it's the the
Yeah,
campaign.
know the signs.
No, it is Know the Signs. Okay,
Yep, of emotional
campaign.
suffering.
Right. So that has gone up and will run all throughout the month of May as well.
Just as a piece of trivia, did you guys update the mobile crisis number so that it's not Harbor Homes anymore? It's Greater Natchez. It's like 762 instead of 816.
I
I'll
know
check
that
to
we
make sure
knew,
our
yeah,
stuff
I
is
know that we knew
updated.
that a number had changed. I'm not sure if it's been updated, but we did know that that number had changed.
Okay, the new one is 1-800-762-8191. The old one is still being forwarded, but the last thing you need in a crisis is to find out that the forwarding stopped on that day, you know?
Yes.
Okay. Thank you, Tom, for bringing it up. Any other questions? Before I open it up to the public, I just want to make one comment because I know I'll probably forget in the hecticness at the end. I want to wish everybody a happy Mother's Day that's here. Celebrate.
Thank you.
Children or mom, 'tis the time to get out there and have fun. That being said, I'd like to open it up to public for comment.
This is Christopher Weir. Can everybody hear me?
Yes, sir. Go ahead.
Okay, so I'll try and make it quick. I appreciate everyone's been on here so long, and I got to get back to work myself. First off, who may I contact to ensure that I'm on a notification list for future meetings that were spoken about with a mask mandate?
I don't think we notify one-on-one, and Bobby can correct me on this. I think what we do is we post it publicly. But if you want to be there, I have no problem with you being there. And certainly, if you kind of somehow get your name, I'll make sure that you are aware of it, okay?
I appreciate that. I just want to mention that was part of when the original mandate was established and a lot of this was discussed. A lot of myself and other business owners in town felt like it was kind of slid in under the radar in such a way that no one was allowed to voice their opinion on the matter before it was voted upon. So if there's not a system in place to notify the general public that these things are taking place, other than us checking the website to see if something's happening, I think we should establish something.
There is a system in place. Just for everybody's knowledge, if you go onto the Go Nashville website, you can create a profile and you can subscribe to any of the meetings that you're interested in. So I would just subscribe to the Board of Health and then you'll be updated. And all of their meetings and everything, the agenda, the topics and all that are posted a week in advance.
Perfect. That's exactly what I was looking for. So that is, that's all I had for now. I guess I'll look forward to seeing you guys at the next meeting.
Sounds good. Thank you. Anybody else out there? Not hearing any peeps. There's nothing on my screen here. I'm going to assume that there is nobody else in the public. With that, looking for a motion to adjourn.
Motion, please.
Motion to adjourn, seconded. All those in favor?
Aye.
We are officially adjourned.